much.
You're welcome.
Surae standing by now with a look at some new findings from IMC's Heart Institute. Surae.
Well, Glenn, new research could help save the lives of depressed heart patients. Here to tell us more about it is Viet with Intermountain Medical Center Heart Institute. And researchers have already known that there is a big correlation between heart disease and depression. What did this research show you?
Yeah, so knowing that, we wanted to know if we could mitigate the effects of depression, especially after something like a cardiovascular surgery. And in this case, we looked at cardiac rehab as the intervention, the therapy. And surprisingly and actually happily, we found that cardiac rehab does mitigate the effect of depression, or at least the risk of death.
So what does that mean, cardiac rehabilitation? What goes into all of that?
Yeah, so cardiac rehabilitation, it's a Class 1 indication. American Heart Association says do it. What it involves is exercise. It involves teaching, educating about smoking, healthy lifestyle, nutrition, etc.
So this research also showed that having depression also can worsen your condition, the heart disease or whatever ailment you might have. Is that correct?
That's right. I mean, it's something that we've seen in the literature, but this is confirmatory. It tells us that depression doesn't mix well with cardiovascular diseases.
So obviously the mental health can also boost your health and make your heart healthier. So what else? Was there anything else surprising about the research?
Well, you know, the thing that we don't know is how cardiac rehab interacted with depression. I don't know if this is just getting people out of the house so that they're not thinking about their own disease, and perhaps helping them to normalize their disease state with others that have cardiovascular disease. They can see at the same time that they're improving on the same level.
And Viet, you co-authored this research. How long was it? How many people, age group? Talk a little bit about the background of this research.
Yeah, so this was a short period of time, about 2 years, just going back 2013, 2015, and we looked at 118 individuals. Now, they had to have answered what we call a PHQ-9. It's a depression scale. Intermountain, we check all of our patients. We want to know what their mental health is. And so as long as they had a PHQ-9 that was completed before the surgery, then they were included in the study. And then once they had the surgery, we looked to see what the outcomes were if they attended cardiac rehab versus when they didn't.
And what was the outcome? Yeah,
so in looking at that, you know, unfortunately, again, depression affects outcomes, death in particular, poorly. So 6% with no depression versus 21% with depression had death. When they went to cardiac rehab, that halved that hazard.
So 10%?
Yeah, so it dropped it down.
That is quite significant. If people want to know more information, obviously that's a great message that you have of making sure that rehabilitation is part of the rehab and the rebuilding of their lives as well, right? Where can they find more information? So
they can certainly come to our Intermountain website. We're, you know, at the Intermountain Medical Center. They can call our general number. It's 801-507-4000. And certainly they can get a hold of me.
All right, thank you. And we'll have more information on our website, goodforutah.com. Glenn.
All right, very interesting. Thanks so much. Still ahead in entertainment news tonight. Actor Charlie Sheen's ex-wife disappears with their kids.